Let me tell you about my emergency room experience last night and kind of early in today. This isn't my usual content, but I think it's really important. Hi, I'm Sherry from Twin Sisters Mastectomy Boutique, and if I look and sound grumpy, it's because I am. I have a lack of sleep. Because yesterday, around 7 p.m., I took somebody into the emergency. And, their doctor had, been speaking to them on the phone. But, what are you going to assess them over the phone? Anyway, this person needed to be seen, quite urgently, I feel. So took them in. And it was 7-ish p.m. And we waited and waited and waited and waited hours before they were seen. And then we had to wait some more, like hours and hours and hours in a very crowded waiting area in the hospital. They were clearly understaffed. And then they were seen and they did some tests, and then we had to wait for the tests to get back. And then the doctor came and he seemed like he was in a good mood. But the minute I asked follow-up questions, he was kind of like put out. You could tell he was put out. He was trying to be polite, but you could tell he was like annoyed that I asked questions because, we ask questions, like, right? And then he said, okay, well, this person's going to need, some IV antibiotics and fluids. So that's fine. Okay, so it takes an hour for that stuff to, go into your body. But halfway through, they checked and there was a kink in the tube, so it wasn't going through. So now we're going to be there for another hour, and this is already 3 o'clock in the morning. And then the doctor says you can go home. If things aren't better in 48 hours, come on back. And in my mind, I'm thinking, come on back? Buddy, this is your shift. You're on the night shift. I'm not on the night shift. I've already done my work, and now this is into my sleep time. I don't have an extra 9 hours to spend at the hospital, but it is what it is. What am I going to do, right? I didn't say that, but that's going through my mind. So got this person home, fine. Those are the negatives. Those are the cons. Here's the pros. We did all that waiting. It was 9 hours of waiting. 9 hours. In the middle of the night. Like, there was people crying. They were so tired. What we didn't get was a big fat bill at the end of it, because our healthcare system is paid through our taxes, right? So there was probably more people in our healthcare waiting rooms and our emergency rooms than maybe in other countries, because if you have to pay out of pocket, you're not going to go to the hospital so soon. So people were there because they knew they could get care. In another country, we might have been doing the same amount of waiting and then being handed a huge bill at the end of it. None of that happened. None of that happened. It's not free healthcare, but it is healthcare paid out of our taxes. And I am very grateful for that, because how many people wouldn't go to the emergency room when they really need it, and then, something terrible could happen. So I'm super grateful for that. The doctor, who was a bit snippy, you know what? He was really busy. And I remember sitting in the room thinking, oh, he's in a really good mood. He was happy. He was jovial. He was laughing. He seemed like he genuinely was enjoying his shift. And I guess me being me, I just asked a couple of questions, like, what's that pain about? And I corrected him on something. They said, oh, well, it's probably kidney pain, blah, blah. And I'm like, that person doesn't have a kidney there. That was just that particular person. And that's when he kind of got bent out of shape. But that's okay. That's all right. So he was in a good mood. The nurses were super nice. And here's what I loved. We were in the waiting room and it was super packed, like super packed. And so this person I was with sat down and I just stood to the side. No problem. I have my phone. I can play on my phone. And people started getting up and shifting their seats so that I could sit down. And then other people would come along and they would shift again, so to make more room. And I'm like, I love Canadians. I love Canadians. And I live in a very multicultural neighborhood. And when I say I love Canadians, I mean I love the people who live in Canada. No matter where you come from, you come to Canada and everybody becomes nicer. And I think that's pretty awesome. Like, it was really, really sweet. Everybody was tired. Everybody was cranky. Everybody was, in some kind of discomfort or distress. And people were like going out of their way to be nice to other people and help them out, and like really jumping through hoops to make the stranger next to them comfortable. And I thought, that is fantastic. Like, who can complain? So I get a lot of clients who come in to see me who will say, oh, our healthcare system, I had to wait a week for this, or, you know, I have this appointment booked, or this, and it's going to take me so long, or, you know, the government only gives us this much money back for a breast prosthesis. And my response is, you know, we're a lot luckier than a lot of countries, because there are some countries that don't get any grant for a breast prosthesis. There are some countries where you would have to pay out of your pocket to see healthcare professionals and get the treatment that you got, and it may even bankrupt you. So I think it's really easy for us to look at, oh man, I waited 9 hours, I have no sleep, the doctor was snippy with me, whatever. But you know what? The doctor was working his butt off. I waited 9 hours with this person, and they got healthcare, they got you know, a follow-up plan, sort of, and they weren't stuck with a ginormous bill that might deter them from getting the help they need later. Because the result of this person's visit said, hey, you know, we're catching this thing early, because it was a pneumonia, actually. We're catching this early, and if they hadn't gone when you know, I brought them in, that could have been really serious. That could have led to death. But because we have a healthcare system where we're not paying out of pocket, and it's not like, oh, can I afford to not go? It saves lives. So I don't know what it's like in other parts of the world, but I've heard that it can be very expensive, a big deterrent to go to the hospital. You know, so what is it like in your part of the world? Do you pay out of pocket for your health care, or is it covered by your taxes? You know, do people go to the hospital when they need to, or do they put it off, and that can probably lead to bigger things? Let me know what your experience is, because at the end of the day, I'm really, really grateful to be living in Canada. As tired and as miserable as I am today, because I have little or no sleep, it is what it is. Still very grateful. Don't forget to like and subscribe. I know this isn't my usual content, but I thought it was important. See you soon.